Mother, there's so many
Do you know that 75% of Americans suffer from one or more chronic illnesses, such as cardiovascular disease, diabetes, depression, stroke, etc.? Our recent experience with COVID-19 pandemic has shown us the consequences of being a nation of people with compromised health living in a toxic environment. As alarming as the number of deaths from COVID may be, they pale in comparison to the annual death toll of chronic illnesses. Every year, according to the CDC, approximately 650,000 people die from heart disease. 150,000 people die from stroke. Another 150,000 people from lower respiratory disease. 85,000 people die from diabetes. 60,000 people die from flu and influenza. And 50,000 people die from mental illness through suicide. Additionally, the third most leading cause of death, claiming on average 250,000 lives. Now, the reason I bring these statistics to you is not to promote fear and paranoia, but actually to inspire you with hope, power, passion, and purpose. You see, the CDC tells us that the majority of these illnesses are preventable, and in most cases, reversible through dietary and lifestyle changes. The CDC goes on to say that the reason so many people are afflicted with these various conditions is not because they are unaware of the problem, but because they lack the education and support they need to create and maintain life-affirming changes. My name is Dr. Michelle Gamble. For over 25 years, I've been an educator, working to empower men, women, and children of all ages around the world. In retrospect, I realize that I've specialized in working with the most disadvantaged people in our nation who have been marginalized and discarded by our society. For almost 2 decades, I've also been blessed to deliver natural healing, empowerment presentations, programs, therapies, and activities to individuals and small groups in several communities that lack access to empowering, ancient wisdom, and modern science-based natural health resources and education that they need to heal themselves, physically, mentally, emotionally, and spiritually. Today, I'm asking you to help me to expand Sankofa's mission by creating and maintaining natural healing communities throughout our nation. Due to the fallout of our nation's response to COVID-19, we will come to have a deeper understanding of the dire consequences of compromised health, economic shutdown, and social distancing for several months and perhaps even years to come. The number of people afflicted with chronic illnesses will continue to rise dramatically, fueled by the significant increase in unemployment and the trauma of fear and anxiety and loneliness triggered by this momentous series of unfortunate events. An analysis of historical data shows us that for every 1% of unemployment, there is a corresponding increase of almost 60,000 deaths given the current American population. This phenomenon is referred to as deaths of despair. As of April 2020, there was an unemployment increase of almost 9%, which leads us to believe that over the passage of the next 3 to 5 years, we will see an increase of over 540,000 deaths that are related either directly or indirectly to our strategic way of dealing with COVID-19. Subsequently, I invite you to join me in creating an alternative future where people are empowered to transform their health, heal themselves, prevent disease, and thus save their own lives.
Dire times require extraordinary measures. That is why It Takes a Village Ministry, a 501c3 organization that is dedicated to creating global change in the area of health through local movements, is going to go to communities across our nation, regardless of race, creed, socioeconomics, because we believe that our strongest source of provision and immunity is having a strong community. Simply talking about the problem is not enough. We need to be committed in words and deeds to creating the solutions. I am inviting you to join us on our Hope and Healing National Tour. This tour is a 1-year initiative to go to approximately 25 communities across the United States, delivering a message of hope, health empowerment, and self-reliance to address the racial and socioeconomic disparities of our current medical system. Now more than ever before, people are looking for ways to have a sense of hope and to be empowered with practical tools, simple strategies, and science-based education to improve their health. The main purpose of the Hope and Healing Tour is to let people know, fear not, you are not alone. You have the God-given power to heal yourself. The wise adage states that actions speak louder than words. Subsequently, we must go everywhere in person, demonstrating with our actions that we are not afraid. We have faith, and we are seeking to build community by any means necessary. At each location, we will have a week filled with empowering events, including a screening of the documentary Medical Racism, which was produced by one of our collaborating partner organizations, Urban Global Health Alliance. And we will have a series of in-person presentations. During this week, we will teach people how to heal themselves using nature's gifts of foods, essential oils, herbs, drugless therapies such as breathwork and healing touch. I encourage you to choose to be proactive victors rather than reactive victims of dying and despair in times of health crises. Empower yourself with the protective gift of health by choosing to be part of the Hope and Healing National Tour. Help It Takes a Village ministry to take this message of hope and healing and self-empowerment to the men and women and children around our nation by donating and or participating in the events when we come to a town near you. And be sure to share this good news with your friends and loved ones.